Hello and welcome to Nurses Lifelong Learning, your go-to place for nursing education and healthcare insights. Whether you are a nursing student, a healthcare professional, or just someone interested in the medical field. So this video is for you. Today we will explore about the crucial role and responsibility of the nurses who are working in the outpatient department. Means that is also called a OPD. So you might, when you have visited the hospital, you might have seen these three alphabets: OPD. OPD means outpatient department. So there we will discuss about the what are the role of the nurse in OPDs. So primary role of nurse is to provide care. So nurses provide care not only in the inpatient department but also in the outpatient department also. So there are different settings where nurses provide care, like hospitals, in the clinics, in the home, according to the patient's need, and surgical centers. Then, what are the different settings? So, OPD is the outpatient department, as I already said. Then, IPD is the inpatient department where the patient get admission in the hospital. Then, ICU is the intensive care unit where patient needs close observation and critical care. There also nurses provide care. Then the home health care. So in the home of the persons, in the home of the patients, nurses provide care according to their needs. Then community health nursing, in the people who are lives in the community, who are sharing the same value and beliefs, like group of people. They will find out their needs, what are the needs of those people, their families and individual needs. Then accordingly they will provide care to them. Then outpatient department, that is a part of the hospital, and they have also some physical facilities, medical and other staffs, and they will have some scheduled hours. They will work there for scheduled hours and provide care to the patient who are not registered as inpatient, like patient did not get admission in the hospital. So outpatient department will provide care to those type of patients. Then a hospital department where patient receives diagnosis, follow-up care, treatment, but do not stay overnight. As I said, patient does not stay overnight. The daycare is provided to the patient and they will go back to their hospital. So this is the first point of contact between the patient and the hospital. So whenever you will visit the hospital, you might see the OPD departments. There you will consult with the doctor. So that is the first point of contact. There, once you will visit that place, there only you will come to know that whether the patient need admission in the hospital or not, or patient will be treated on outpatient department or on the daily basis. What are the objectives? Objective of the OPD is, first one is the provide care, quality of care. So quality of care means overall holistic care should be provided according to the need of the patient. Then the modern techniques should be used to providing care for any diagnostic test to diagnose the disease, or in treatment also modern technology should be used to provide care. Then facilities for total patient satisfaction. If the patient's needs are fulfilled, patient, then only they will get satisfied. So according to the need of the patient, nurses should provide care to the patient, and then only patient will get satisfied. Then the good public relation. So good public relation means they should have the good communication skills with all the, then only they can maintain the good public relation. Then functions of the OPD. It is the major source of specialist medical opinion. Like when the patient gets sick, they will first go to the doctor, and doctor will be in the OPD department. There they will diagnose. On the basis of their diagnosis, they will find out what step they have to take further. Screening for admission to the hospital. They will write some diagnostic test. If they will feel like patient need the hospital admission, then they will admit the patient. They will admit the patient on the basis of the diagnosis. They will diagnose the disease. They will start their treatment early stage so that patient can be prevented from any type of complication later. Follow up care and care after the discharge. They will educate the patient, nurses will educate the patient regarding their medicines, their nutrition, what are things they have to follow when they need to visit the hospital. Then promotion of health by health education. So they will provide health education related to the which type of exercise is good for them, which type of nutrition is good for them. So accordingly they will take a good nutrition, they will do physical work, then they will take the medicines on time. Then types of OPD. So there is a general OPD where patients directly visit the doctor. Emergency OPD means where the patient who needs urgent treatment, to save their lives, there that is called the emergency outpatient. Then referred outpatient means if the patient needs any other specific doctor's opinion within the hospital or outside the hospital, so they will directly refer the patient to that particular department within the hospital or outside the hospital. So processing the OPD, once you will arrive at the OPD, you will go to the reception, get registered yourself, then you will wait for your turn, then you will visit the consultant doctor or doctor. Then if the doctor feels like they will write some medications, then you will go to the pharmacy. Then after pharmacy you will get the medicine from the pharmacy and you will go back to your home. But other side, if the doctor feels like there is a need of any other doctor's opinion, they will refer to the patient to the that particular doctor. Then what are the role of nurse in OPD? So nurses provide, as I said, direct care to the patient in the form of medicine, in treatment as directed by the physician. So nurses, when the patient direct come to the hospital, nurses will also assess. They will assess their needs. What are the needs of the patient? What are the symptoms of the patient? So on the basis of that symptoms, they will find out that they will make the nursing care plan. Doctor will prescribe the medicines to them, they will take that medicine, they will give that medicine to the patient. They will, if the patient has any other needs, they will check their vital signs, they will change the dressing if there is a need. If the patient doctor has written any diagnostic test, then they will take the sample, blood samples. So all these things are done by the nurses in the OPD as well. So healthcare provide healthcare advices through educating the patients and their family members. So they will give the education to the families and the patient as well. The nurses provide care to all the age group. It starts from the birth till older age. Then they will also organize the health camps and provide routine care to and emergency care to the patients. So this is all about the OPD departments. Next video I will be discussing I will discuss about the inpatient department. What will be the role of the nurses in inpatient department? So if you like my videos, please like, share and subscribe. And if you want me to make such videos, then please write in comment below. Thank you so much. Thank you for